Hello, everyone, and welcome to the second in a series of Radiation Oncology Resident Roundtables. I'm Neha Vapiwala, a radiation oncologist and professor at the University of Pennsylvania School of Medicine. I also serve as the Vice Chair of Education and the Dean of Admissions at the Perelman School of Medicine at University of Pennsylvania, and have the privilege of working closely with ASTRO as the Secretary Treasurer on the Board of Directors. I have also the tremendous privilege of moderating today's discussion. So the purpose of today's webinar is to give you, as medical students, more information about the specialty of radiation oncology and the opportunity to hear directly from 4 of our current radiation oncology residents about how they got into the field, what their day-to-day experiences are like, what they look forward to in their future careers, and any other topics and questions that you may have shared with us. We will then provide some resources that can help you access even additional information to learn more about the field of radiation oncology. And then we'll close out the session with contact information for all of us if you should wish to reach out to us at a later time. So without further ado, I'm really excited to introduce our panelists today. They're all members and leaders of ARRO, the Association of Residents in Radiation Oncology. ARRO is an independent organization that represents radiation oncology residents in the United States and works incredibly hard to improve the quality of education for resident physicians in radiation oncology and to tirelessly advocate on behalf of residents to ASTRO's organizations and committees on all matters affecting residents and residency training. So it's a great pleasure to be able to meet our panel today. And what I'll do is I'll just ask each of them to go ahead and introduce themselves and describe a little bit about their roles within ARRO. So we have Dr. Kelsey Corrigan to start, and then Dr. Abhishek Kumar, followed by Dr. Michael LeCompte and Emily MacDuffie. So Kelsey, would you like to start?
Yes, thank you so much for that introduction. My name is Kelsey Corrigan, and I am a current PGY4 resident at MD Anderson in Houston, Texas. Right now on ARRO, I am co-chair of the education subcommittee. One thing that we all wanted to share with you guys during our introductions was one thing that we're very excited about for the future of radiation oncology. So my clinical and research interests are in radiation toxicities and survivorship. So one thing I am super excited about for the future of radiation oncology is all the new technologies that we have, like MRI LINAC treatment machines and flash therapy, which truly these technologies seem like they're coming out on a daily basis. But what I find so cool about them is that they are all meant to produce really conformal treatment plans, which should reduce toxicities and hopefully in the long term improve survivorship and patient quality of life. So that's one thing I'm super excited by, and I can't wait to see what other technologies our field comes up with.
Well, Kelsey, that was good. I have to go after you now. I'm Abhishek Kumar. I'm a PGY3 at Duke University. I'm the co-chair of the Communications Committee. I'm from the Bay Area in Northern California. I went to college at Duke, did medical school in San Diego, and was fortunate to match at Duke again for radiation oncology. What excites me most about radiation oncology? That's a really tough question, but because there's so many answers. I have to say the expanding indications of radiation, especially in metastatic disease. So stage 4 disease has been thought to be incurable, but now, we're not so sure. Patients with limited number of metastases or oligometastatic disease, oligo meaning some, there is a thought that we can use radiation treatment to control those sites of disease and actually help extend life. That's something that I'm very excited about. Other expanding indications of radiation treatment that were presented at ASTRO were the role of radiation treatment in prolonging life for patients with liver cancer, and also the role of radiation treatment in kidney cancer. So we're just treating more and more patients to help them live longer and also live better. So I'm really excited about that.
Thank you.
Hello, I'm Michael LeCompte. I'm a PGY3 at Johns Hopkins University. Originally from the state of North Carolina, went to UNC for undergrad and Wake Forest for medical school. One thing that I am certainly excited about for the future of radiation oncology is the one thing that we've seen through ASTRO and now through ARRO is our dedication and commitment to improve diversity, equity, and inclusion going forward. Our field currently is not had the best workforce diversity. And that's something that our organizations have been putting towards the forefront to try to improve this going forward. Our studies and several pieces of literature show that our patients do the best whenever our workforce looks similar to the communities that are treating those patients. So I'm certainly excited and interested in how we can improve this going forward.
Great. Hi, everybody. My name is Emily MacDuffie. I'm currently a PGY3 at the University of Pennsylvania. I grew up in Maine. I went to Swarthmore College, very close to Philadelphia, and Brown for medical school. Currently, I serve as the co-chair for the Global Health Subcommittee of ARRO. And along those lines, one of the things that I am very excited about moving forward in this field is the expansion of radiation oncology into the world of global oncology care. For many years, people who had an interest in global oncology found it a little bit hard to match up those interests with the field of radiation oncology. But we have had some really incredible support over the last decade of people who are interested in combining their interests in serving patients across the globe in their access to radiation. And whether that's in low middle income countries, whether that's from policy perspectives on a national and global standpoint, or even local expansion to underserved communities here in the US, there's a lot to be done in this sphere, and it's something that's being really supported. And so I'm really excited to move forward for my own career in particular, being able to think about these big picture questions because they're really hard problems to solve and we need good minds toward it.
Indeed, that is so well stated for each of you to share this. Thank you so much. And as the older lady in the room, I will say the thing I'm most excited about is hearing each of you speak to, not only the shared missions that we all have, but also, the individual passion that you bring to where you are and wherever you're going to go next. And in terms of, what that does and what that will do for improving cancer care. And of course, building our community, I'm, forever indebted. So I'm most excited about that for each of you. So I guess on that theme, and maybe we could start with Kelsey, I'd love to hear, what are your thoughts on how a resident can get more involved? Each of you are leaders in ARRO, but, not only involvement in ARRO, but in other ways. How does one get more involved? And how do you get the most out of this special time that is residency?
So I think this is a great question, and I totally agree with you that residency is one of the most special times, and it's a very unique time. And, we only have 4 years in radiation oncology, so it's a great question and how to get the most out of those 4 years. So first, I'll speak on one of the hot topics in getting involved in radiation oncology, which is research. So from an academic or research standpoint, residency is definitely the time where you can do research on literally whatever you are interested in. And it can start off with a simple email to someone at your institution or even to someone you follow on Twitter, just to ask them more about what they do and if there's any role for a resident to help out. And your research doesn't have to be on something, super specific in the radiation oncology field. We have some awesome residents right now in our field who are paving the way for very unique and novel research questions about climate change and financial toxicity and many more topics. So I think it's awesome just to get involved by doing research on something that aligns with your passions, even if it is outside of our field. And this actually brings up an awesome question that one of our audience members asked us, which was, what are reasonable expectations for a PGY2's research productivity? I think as a new PGY2, this is a very individualized question that will be different for everyone, but what should be the same for everyone is that you are prioritizing your transition into radiation oncology, which might include moving across the country. And it definitely includes your mental health and learning about a whole new field, for some people for almost the first time. So if that means you don't do any research as a PGY2 at all, that is totally okay. At my institution, we actually tell residents that they should feel zero pressure to do a single piece of research during their first 6 months until they feel fully acclimated. This being said, if you do want to start doing research right when you get started at PGY2, then my advice would be to talk to your senior residents about setting you up with an attending who has a good PGY2 level project for you. Lastly, I'll mention a few other non-research academic ways to get involved during residency, which include getting involved in a medical society, like ARRO, which all of us on this webinar are a part of and have really enjoyed our experience. There are also a lot of other medical societies as part of our field that have really great leadership opportunities, like through ACRO, SWORO, RSS, and even more generally, the AMA. So there are tons of opportunities out there for residents to get involved in scholarly and leadership research and non-research activities.
Really helpful overview. Thank you, Kelsey. Abhishek, what do you think about resident engagement and how one gets the most out of their time?
There are many ways to get involved. And I think that, when you come in as a PGY2, you've had 1 year as a doctor. And, you should congratulate yourself at the end of that year. It's a tough year. And you've earned your stripes as a doctor. You know how to diagnose, you know how to treat, you have a lot of experience. And now you're switching gears to something entirely different. And hopefully, your passion, and this is what you want to do. So bring that excitement with you to your residency. It can be intimidating to walk into a room of, PGY 3s, 4s, and 5s and attendings, but all these people are really excited to have you. So use them, use your co-residents, your senior residents to ask about, hey, how do I contour this case? I don't even know what I'm looking at. In radiation oncology, we're unique. We go from being interns to almost like fellows because we work with attendings one-on-one in an apprenticeship model, which is amazing. You can really get to know your attendings, and yet pure teaching can fall by the wayside if you're intentional about, as a senior resident, teaching your junior residents. So I encourage senior residents to do that, but also as a junior resident, asking for help, bringing that excitement. I mean, that's something I did coming in to Duke. I'm someone who's not very shy. So I, found the most senior resident and said, hey, do you have 10 minutes? Can you please help me find the tumor? Where is it? And so really utilize your peers because they're the best teaching, I think the best teachers. And, they often say, see one, do one, teach one. Well, you're actually helping your senior residents out too by asking them to teach you. And of course, there are many great resources available. I'm not going to detail all of them. They're actually on our website. If you go on ASTRO's website and look for ARRO educational resources, Kelsey and Bailey have worked really hard on the education subcommittee to really nicely delineate all these resources. But one, some that come to mind to me for those who are brand new PGY2s is one, like knowing how to stage a patient with cancer. So, the NCCN guidelines is incredibly helpful for that. What are you looking at when you're looking at imaging? So e-anatomy is really helpful in understanding what the different, anatomy is from head to toe on MRI and on CT scans, and oftentimes programs will pay for that. And if they don't, then it's actually fairly affordable each month. It's I think $5 or $6. And then there's eContour, which many of you have heard of, which is an incredible resource that's fairly new in the last 5 or 6 years, that has really expanded its cases. So you could go and eContour and find a case that is similar to the case that you're working on and actually see how others have contoured the case, and they explain in a really nice way how to do that. So there's so many resources online, like there's RadOnQuestions.com. There's so many, so I don't want to inundate you, but I guess overall I will say go to your senior residents and really take the time to ask them for help, and they'll be more than happy to help you.
Well, and I think it's so great that, not only is there this compilation of resources, but I think a really important point you make, even for those of us that might be relatively introverted, is that we are an incredibly welcoming specialty. And I remember even when I was a trainee and junior faculty feeling like, oh my gosh, there's so-and-so, and it's so intimidating to go and chat with this person. And then you realize actually they are among the most approachable people ever. And so one thing that I find has continually been a pleasant surprise is just, again, how much more approachable people are than what you might imagine. And so even those of us that might be a little shyer or quieter, I think you may find that just having those one-on-one relationships with your senior residents, with your peers, is also an incredible resource, as are, of course, the faculty, and then all the wonderful compilation of resources you just mentioned. So Michael and Emily, anything you'd like to add?
Yeah, I think we think a lot about what's in clinic, what we have access to, and the patients that we're seeing in consultation and thinking about their problems. But I also think there are things that you can do outside clinic that can be really rewarding. I had the opportunity to give a short presentation to a cancer support community meeting. This was explaining in very basic layman's terms what radiation was, when it might be indicated, and kind of answered some questions that to us are really simple, but to someone who's not familiar with radiation are very important. And that's an amazing group that I hope to continue with and have continued to interact with. And so I think there are other opportunities outside the clinic that you should always be aware of and kind of looking out for, because they really can make you feel like you can have an impact, not just when you're in your consult room.
Yes, and I would add that, as a specialty, I like to think of us as very approachable, but we also have a lot of passions. And sometimes out of clinic, you can find those passions as well. And we come into this specialty with those. One of my co-residents is part of the board of local Camp Kesem, and continues that passion and continues to work with children outside of clinic and continues to help in that capacity. So, what got you to this point, continue to do that and look for opportunities outside of clinic.
Well said. And so, Michael, if I could follow up with you, what are some of your favorite conferences that medical students and residents should consider attending?
Yes, great question. So, as part of ASTRO, I always think of, the fun times I've had at ASTRO and meeting these fellow co-residents here on this call at ASTRO meetings. It's typically in September or October. The abstract submission is currently open, so I highly recommend those listening to submit their research and to attend this upcoming year. It's October 1st through the 4th. The day before ASTRO, we have ARRO Day. It's an annual seminar. It's a day-long program where current and prospective residents can learn through sessions that are geared towards residents. And those topics can include professional development. It allows for networking opportunities. This past year, we had a meet and greet. We had several meet and greets throughout the ASTRO program, but through ARRO Day, we had a meet and greet. And then also those sessions, this past year, we had a session that was built to talk about how to write an effective abstract, which is a highly effective skill. And we're looking to having a similar program next year, and we're certainly excited. We always welcome medical students to this program. This past year's ASTRO had over 250 medical students. So that was very exciting. So we're looking to have more sessions going forward geared towards medical students. We had one this past year, the Aspiring Scientists and Physicians program, but that's something that we look to build on.
Absolutely.
Sorry, go ahead.
Absolutely. And we look forward to seeing everyone there. So.
Yes.
So Kelsey, if I might ask you from a resident's perspective, what are some lessons learned from virtual medical student interviews that you can share with us?
So that is another great question, and especially very relevant right now. I imagine that a lot of med students are wondering how to approach their virtual interviews and how to get the most out of them. So I can offer up a few pieces of advice. So first, I think it's important for med students to know that technical issues and awkward moments are going to happen, and that is okay. Now that we're a few years into virtual interviewing, programs are fully aware that mishaps are going to happen, but they will be flexible with you and understanding. I know it might cause a lot of frustration from a med student's end, especially because you're trying to impress the program, but I encourage you, if there is a technical snafu, just remain calm, be open to flexibility, and be understanding about these issues because they are inevitably going to happen on both of our ends. Second, it may not seem like personality comes through on virtual interviewing, but I actually don't think that's true. I've definitely noticed that applicants' personality, energy, and positivity really do come through over virtual interviews. And it's definitely still possible for us to get to know you and vice versa on the virtual platform. I actually think programs are extra observant of applicants on Zoom because we really are trying to get to know you so well. And I also encourage applicants to be extra observant of us too, to get to know us. Look at how many residents are showing up to the interviews to get to know you, or look at how the attendings interact with each other, or how excited is the program when they're trying to sell you to come there. These are all important observations that med students can still make about programs, even though everything is virtual. A few last things. So, always make sure you have questions ready to ask. Number one, it's important because residents are very eager to answer your questions. And also having some questions ready is helpful if there's any awkward silences or downtime. Also, I would recommend trying to attend all of the virtual offerings that a program is sending you for their interview day. Attend all that you can as possible, because again, you want to show as much face time as you can with the program. And finally, be honest and have fun. Even though it's over Zoom, programs still want this to be a special and rewarding experience for you. And, because of this, that means some programs are very enthusiastic, and they might be over enthusiastic and tell med students that, they want them to come for an in-person second look, or they might ask students if they want any extra attendees' contact information after the interview. And I know this might be a big point of anxiety or stress for students because you might not know what to do with that information. Mm-hmm. So Dr. Vapiwala, I was wondering if you could weigh in on this from an attendee's perspective. Do you have any advice for med students on how to navigate the post-interview process? For instance, what to do when students are asked to let a program know if they would like to come for an in-person second look?
Yeah, sure. Great question. And it's probably a topic of its own webinar, but I will say in short that, there was a time where it was felt that perhaps too many opportunities were available to, those students who might have pursued post-interview communication at a given program, and then maybe somebody else who didn't know or wasn't aware that that was doable, created some inequity, not only in access to attendings and to programs, but also the ability to express interest. And if you follow the rules of the National Resident Matching Program, which are pretty clear in the Code of Conduct, strictly speaking, you're not supposed to have any post-interview communication. But ultimately, we realize that that's also kind of swinging the pendulum in the other extreme. And as I just got done saying, we're a very approachable specialty. We have people all throughout, the radiation oncology spectrum of career ladder who are very eager and interested and enthusiastic. And so it would be a shame to try and say there should be zero contact. I think the right balance is for each program, ensure that you are not either offering information or making promises that you're not supposed to make or able to make. It's a small specialty, people will remember. So it's telling every single place you visit that you're the top program, or I'm most interested in coming here, when in fact you're saying that perhaps to 2 or 3 other places. Of course, none of us really would necessarily do that intentionally, but you'd be amazed, how that can happen even innocently. And you just want to be very aware that that is really not recommended, that one go down that path. If you have specific questions, usually the program coordinator or the chief residents are the best place to go for those questions. And then if you really need something answered by a faculty mentor, or particularly the program director or chair, again, wait for the program to offer that opportunity if your questions can't be addressed by others. And that way it doesn't look like you're also trying to, perhaps over negotiate or be overly pushy. And I know it's so tough as a medical student to find that right balance. So if you're ever really uncertain, you can also always ask. Obviously there's all of you as resources, but if you have someone at your home institution, even if they're not in radiation oncology, advisors that you have can hopefully direct you. But I would say you don't want to push too much, and you want to be wary of doing anything that would be against the NRMP Code of Conduct. So switching topics now, Abhi, I'd love to hear from you if you could describe the basic day-to-day routine of RadOnc residency.
Yes, I'm happy to answer that question. So the great thing, or there's so many great things about our field, but one of the things about radiation oncology residency is that no 2 days are really the same. So I'll just give you an example of what my day-to-day looks like right now. Granted, I'm at Duke, so maybe programs might be a little different, but I'm on an amazing rotation. I'm on gynecology, in which we do a lot of brachytherapies, which are treatments where we give radiation internally. So oftentimes these are procedures in a, kind of like an operating room, but it's like a procedure room where patients are under anesthesia, so you work with your hands a bunch. But then I'm also working with Dr. Kirsch, helping patients with sarcoma and ocular melanoma. So on Monday, I have brachytherapy where I get in early morning and I work on cases with Dr. Chino, and we do 4 or 5 cases, and there's a lot of contouring involved because you go and place your applicator and you go ahead and then contour after that. And once you're done contouring, you do another case, and it's just all day's procedures and contouring, and you work directly with the attending, which is amazing. And then the next day, I have an office day, which is, I work on notes and contouring and just kind of get all of my organizational orders in order. So that's my office day. And then on Wednesday, I have a clinic with Dr. Chino where I see patients in consult and also in follow-up, all day. And on Thursday, I work with Dr. Kirsch where I work, where we see patients with sarcoma. It's similar to the day before, where it's all day in clinic. And oftentimes, we'll go to the CT simulation to help prepare a patient who's getting ready for radiation treatment. So we're often multitasking. And then on Friday, I'm back in the brachytherapy suite with Dr. Chino. So, it's a really awesome rotation, and that's very different from my day-to-day on a different rotation where I might be treating lung cancer or prostate cancer.
Yeah, I mean, it's, I think because as radiation oncologists, we are trained to treat ultimately every adult and pediatric cancer known to all of us, and also those that are not known, many that we're still learning about. Just because of just the sheer breadth of the diagnoses we take care of, I think the variety in your training as a resident is just, I think, unparalleled. And what you described just now on any one rotation, obviously it's a compilation of a lot of patient interaction, a lot of opportunities to do procedural work with your hands, the technical aspects, opportunities to, do the equivalent of internal medicine rounds. I really think, again, it's a specialty that brings in the best of so many other specialties and never a dull moment. So thank you for sharing that with us. So Emily, could you tell us, shifting gears again, about some significant changes to RadOnc residency in the past few years that you think new residents should be prepared for?
Yeah, so there have been a couple changes that have been sometimes reactions and sometimes just formalizations. One example is leave policies. So all residency programs, all kind of governing bodies have the ability to create policies that govern a large number of residents. As radiation oncology, we're covered by the American Board of Radiology. And just in these past few years, they've formalized leave policies, which has been really important for residents who become new parents, who need to be caregivers, who need their own personal medical leave, or if there's bereavement, and then other things like just interviews for jobs, vacations. So one of the changes that's been formalized is that residents can have the ability to take 32 weeks over the 4 years of radiation oncology training as needed and approved by their programs for those leaves without having to extend their total length of training. And that's something that's formalized to help prevent extensions of training for residents who have these life events that they really need to make sure that they're taking care of outside of their formal training. Another change that we've seen is a change to our case logs. So as residents, we log every case that we simulate and contour to keep track to make sure that we're getting adequate experience during training. And so recently there have been some increases in the brachytherapy requirements as well as unsealed sources. So that's things like oral therapies with radiation that patients take, as well as better defining what types of cases we need to make sure we have. For example, making sure we have 41 head and neck cases, for example, or at least 12 pediatric cases. And so these just really better ensure that when you go out into practice that you've had the experience you need to practice independently. An additional change that came with COVID-19 was that all the examinations have become virtual. As residents, we take physics exams, we take radiation biology exams, We also take written board exams. So those are kind of your general multiple choice questions that we're used to taking. And then we also have an oral boards examination that happens 1 year after graduation. And so all of these exams are now able to be done virtually. And there's no current changes as we know of that will necessarily change. Although there's always a chance, I know that some people miss the in-person experience of oral boards. So we'll see where that goes in the future, but it has really helped a lot with the ability for us to be more flexible as residents, to have to do less travel for these types of things, which is really helpful for quality of life.
Absolutely. Well, thank you. And I know each of those topics could be, discussed in greater depth. So hopefully many of our attendees today will reach out to us with additional questions. So the last question, and I want to hear from each of you, of course, what is your most rewarding experience in radiation oncology residency so far? So why don't we, Emily, go ahead and start with you, and then Abhi, Kelsey, and Michael will have the last word.
Yeah, I think, I think that this sounds very cheesy, but to be perfectly honest, using what I've learned so far in residency about this really cool, very niche field, and being able to learn how to share that with patients has really been the most amazing thing so far. I think that as we go through training, everything becomes kind of rote and obvious and okay, radiation, we get how it works, but our patients don't, and it's a total black box for them. And so being able to open that box and share our knowledge with them in a way that they can understand has been really rewarding for me.
I think I'm next. I've been thinking about this question all week, and it's been really hard for me to answer it. So that really stands out. It was a patient had shortness of breath, and they were admitted, and it was unclear what was going on. And a CT scan showed that they had a large mass in the middle of their mediastinum. It was found to be lymphoma. And when I saw this patient, she was really short of breath, really struggling to talk. And we were able to plan her that day with radiation treatment. And within 3 days, she was able to go home and enjoy some of her holiday. And we saw her the next week, and she was laughing and really appreciative of the care she got. And I got to see her personality. And I just felt a lot of joy in that moment. So I think about that experience, about how much we can really help people and really treat cancer head to toe. And we're, truly privileged to be in this position. So I would say that's probably my most rewarding experience in the last 2 weeks, but every week there's another experience that takes over.
That's the beauty of it. Kelsey?
I totally agree with you, Abhishek. It's really hard to pick just one moment because our field is filled with tons of amazing moments, with patients and with each other. One rewarding experience that comes to mind right now while I'm on research year has to do with one of my projects, which is focused on patient education and is piloting a study with patient education videos before the radiation consultation appointment to prepare patients for their appointment and for what's to come with radiation treatments. And after watching my patient education videos, some of the patients on my study have reached out to me to express how much they enjoyed the videos and how they feel like the videos have really helped them with their anxiety before the appointment. So it's made me feel like my research is really having an impact on patients, and it's really helping. And so overall, it's been a really cool experience.
Yes. And Michael?
All right, I'll round things out. And it was very tough to come up with one singular experience. And I can think of multiple patient encounters, and I love patient care. But one thing I kept on coming back to was the people I've met in radiation oncology. Going back to how approachable people are and how nice people have been. I'm going back to thinking about my residency interviews and then going into COVID. And then after that, me and a few now PGY3s, fellow PGY3s, had weekly game nights where we just met virtually. And knowing that I'll have those lifelong friendships and being able to see their careers bloom have been an amazing experience.
Truly heartfelt, each of you, and thank you so much. I hope to everyone listening that you can appreciate that we're just scratching the surface. There really isn't enough time to go through all of the wonderful things that we want to share. Like we said, this is just the beginning of a conversation. And you can see all of our names and contact information available. So please do reach out with additional questions at any time. You'll see that ASTRO has assembled a dedicated section just for medical students, so you can learn more about the field. You can find it on the homepage of astro.org. And there is a collection of video interviews with practicing radiation oncologists, a journal collection with important articles and studies related to the field, some of which we reference today in terms of the sheer clinical breadth of what we see. And then also articles that are specifically of interest to medical students, including podcast interviews and so much more. So in addition to the section for medical students, we also have a set of narrated presentations that give you just a much deeper look into the field of radiation oncology, presented by a wonderful colleague of ours, Dr. Malcolm Mattis. And the first presentation is actually an intro to RadOnc and how radiation oncology incorporated it's incorporated into multidisciplinary cancer care in the academic setting as well as in the community practice setting, because we are, of course, so much more than radiation oncologists. We are oncologists, and in the end, we work very closely with a huge team in all of our practice settings, all dedicated to the care of the cancer patient. The second presentation in this series discusses radiation oncology as a career, the realities of what it's like to become a RadOnc, the competitiveness of the field, where the future is headed in terms of radiation therapy, applications, research, and of course the current job market as well. And so this presentation discusses, in addition to all of these aspects, the need that Michael referenced earlier about how diversity within our field is so integral to our role as care providers, and how radiation oncologists can work not only to increase diversity within our workforce, but also to address health disparities in the populations we serve. I also encourage you to become a member of ASTRO. Membership for medical students is free, so just sign up and you'll get access to all of this information, all the resources, our weekly Astrogram emails, our quarterly Astro News magazine, and then also a reduced rate for subscription to our premier journal, which is affectionately known as the Red Journal, International Journal of Radiation Oncology, Biology, and Physics. And it is, in fact, the leading scientific journal dedicated to radiation oncology. So I just want to point out that, as I mentioned, ASTRO is committed to diversity, equity, and inclusion as a core principle for the organization. And although we long had a committee that focused on diversity, health equity, and inclusion initiatives for the society and the field of radiation oncology, we now also have a council, which is essentially recognizing its place at the board level in terms of our dedication to all aspects of diversity, health equity, and inclusion. And as medical students, you guys are the future. So we're always looking to you for ways to think about more inclusive programs, products, initiatives that we should be investigating. So we want to hear from you, and this is an open offer. But this slide here just showcases some of the webinars that we have had in the past year in our DEI and radiation oncology series. So love to hear your thoughts on this, as well as what else we could be doing better. And then finally, one major opportunity I want to bring to your attention is the ASTRO Medical Student Fellowship Award. This is an award that introduces medical students from backgrounds that are underrepresented in medicine to the discipline of RadOnc early in their medical education. So medical students in all years are encouraged to apply, but preference is given to first and second year students who are still early in their career. And not only is this an effort to promote radiation oncology as a career choice, but the idea behind this fellowship is to provide medical students with an experience to expose them to clinical, basic, and translational research opportunities in radiation oncology. And when I tell you the field is booming with opportunities, with questions that need to be answered, there's a project for everyone, I promise. So having this experience through this scholarship and this fellowship award is incredibly important. The application period does open December 14th, 2022, so this week, and it runs through February 16th. So I encourage you to learn more about it and to apply. And finally, I just want to thank our panelists once again for sharing their experiences with us today. As you can see on the slide, we're all active on Twitter. And of course, that's a great way to meet people virtually. And we encourage you to send messages to any of us via Twitter or DM, and we'll be happy to get back to you. Thank you so much for taking the time to join us. And remember to check out astro.org for all of the latest information, and keep an eye out for the ASTRO booth at the upcoming American Medical Student Association, Latino Medical Student Association, and Student National Medical Association meetings, all coming up in 2023, where you can talk directly with radiation oncologists about the specialty. And we hope to hear from you soon.
Thank you. And if any of the medical students ever see us at a conference, please say hi and introduce yourself. We'd love to meet you all.
Yes, I'm sure would. Take care, everyone.
Thank you so much.
Thanks.
Thank you.